Hello, friends and colleagues. This is Masaru Tateno from Sapporo, Japan. Thank you, Professor Mack and organizing committee for giving me this wonderful opportunity to talk. I will talk about internet addiction, excessive gaming, and depressive symptoms in adolescents in Japan. I have nothing to declare regarding this presentation. The internet has become an indispensable part of our daily lives. As a result of the widespread penetration of the internet into society, its excessive use has become a major social problem, especially among adolescents. In this presentation, I will talk about internet addiction, excessive gaming, and mental health issues in adolescents in Japan. This slide shows the agenda of my talk today. I will begin with a brief overview of internet use in Japan. This bar graph shows the rate of internet users in each country. As you can see, Japan has relatively higher percentage of the population that uses the internet. The results are slightly different from the previous slide due to differences in methodology. But again, the survey by Japanese government also reported a high rate of internet use in Japan. I will show you the results of a survey by Cabinet Office, Government of Japan. This graph demonstrates the rate of internet users in each age group, answered by the family and the individual. This survey was conducted early last year. As you can see, about half of 3-year-old children use the internet in any ways, and the percentage is as high as 96.3% at the age of 13. It can be said that the age to start using the internet is becoming younger year by year. One of the serious problems regarding the internet is the amount of time spent online. It is surprising that the almost 15% of 3-year-old children spend longer than 3 hours on the internet every day. I briefly summarize what I talked in the first part of my talk. Almost 90% of the population uses the internet. The age at the first exposure to the internet is becoming younger. Young children spend a considerable amount of time on the internet. Then I proceed to the second part of my presentation. This large-scale survey was done by Professor Yoshiaki Hashimoto, Tokyo University in January 2014. More than 15,000 high school students were invited to this survey. The degree of internet addiction was assessed by Young's Internet Addiction Test, IAT. The rate of students at high risk for internet addiction was 3.9% in male and 5.2% in female. Next year, in 2015, a similar survey was conducted in Yokohama at junior high schools. Yokohama locates in Tokyo metropolitan area. The total number of the subjects exceeded 10,000. The rate of students at high risk of internet addiction was slightly higher than high school students, and it was 5.1% in male and 6.2% in female. This slide demonstrates the results of the study performed by Dr. So and his colleagues at the Okayama Psychiatric Medical Center in 2016. The prevalence of internet addiction in adolescents with neurodevelopmental disorders, ASD, and/or ADHD was significantly higher than the surveys conducted at school targeting non-clinical samples in the same age group. I will summarize what I talked in this part. Adolescents are at a high risk for internet addiction. In particular, adolescents with developmental disorders are at higher risk. Prevalence of internet addiction is twice as high in developmental disorders as in adolescents with typical developmental history. Next part is excessive gaming and gaming disorder in Japan. Kurihama Medical and Addiction Center carried out a nationwide survey of internet use in 2019. The number of respondents was 5,096. Among them, 60% of male internet users played online gaming. This is a flow diagram to identify study participants in the development of the games test and to estimate the prevalence of gaming disorder. Gaming test is a 9-item short screening test for ICD-11 gaming disorder. After the completion of face-to-face diagnostic interview, Dr. Higuchi and his colleagues estimated the prevalence of gaming disorder at 5.1% according to the guidelines of ICD-11. From now on, I will introduce our study on social withdrawal and internet addiction. The subjects were 478 healthy college and university students in Sapporo, Japan, with the mean age of 19.6. I will briefly explain about hikikomori. Hikikomori is defined as a severe form of social withdrawal. Hikikomori subjects remain in their own homes, avoiding various social situations for at least 6 months. Not many of them, but some of hikikomori subjects might be addicted to the internet. In this study, hikikomori trait was assessed by HQ25, a self-rating scale developed by Dr. Alan Teo and his colleagues. This graph demonstrates that the degree of internet addiction and hikikomori traits correlated significantly. Next, we made two subgroups, students at high risk for hikikomori and low risk for hikikomori based on the total scores of HQ25. As you can see in this slide, the subject with high risk for hikikomori spend significantly longer on the internet, significantly more addicted to the internet. Then we performed a two-group comparison according to the main purpose of the internet use, gaming and SNS. Our results revealed that gamers spent much longer on the internet in both weekdays and in the weekend compared to those who use the internet for SNS applications. Similarly, gamers were more addicted to the internet and had the higher total score on HQ25, suggesting that they were socially withdrawn compared to those who prefer SNS. The prevalence of gaming disorder in Japan is estimated 5.1% based on face-to-face interview. Individuals with internet addiction could be socially isolated, and internet addiction might be a risk factor of hikikomori. Gamers could be more addicted to the internet compared to the internet users prefer to social networking services. I move forward to the last part of my presentation. Internet addiction, excessive gaming, and mental health problems in adolescents. We performed a survey on excessive gaming and depression among adolescent patients who visited our hospital. All patients at age 10 to 18 years who visited the Tokiwa Child Development Center during the survey period were invited to the study, and of those who gave their consent were enrolled in this study. Almost 70% of them were diagnosed as having ASD and/or ADHD. Exclusion criteria included moderate to severe depression or moderate to severe intellectual disabilities, and patient withdrawn by treating child psychiatrist for any reason, etc. We asked the subject to score 3 self-rating scales. Patient Health Questionnaire 9 for adolescents, PHQA. 10-item Internet Gaming Disorder Test developed by Kirari and his colleagues, so-called IGDT-10. Young's Internet Addiction Test, known as IAT. PHQA was a modified version of PHQ, which assesses the severity of depression in adolescents. PHQA consists of 9 items and its total score ranges from 0 to 27. 10-item Internet Gaming Disorder Test, IGDT-10, is consisted of 10 items regarding gaming behaviors. More than 5 items scored 2 is regarded as screened positive to Internet Gaming Disorder of DSM-5. The graph represents that the total score of IAT and PHQA had significantly correlated between them. Statistical analysis revealed that the mean total score of PHQA was higher in patients with internet addiction. We investigated the correlation between the total PHQA score and the number of items scored 2 on IGDT-10. A significant correlation was observed between these two factors. When we scored IGDT-10, according to the method proposed by the developer of this scale, only 6 patients were screened positive for internet gaming disorder. The patient with probable IGD had higher total score on PHQA, which means they had more severe depressive symptoms. Next, we scored IGDT-10 according to the manner proposed by one of the Japanese research groups. When we defined 1 and 2 as meeting the criteria, 24 patients were screened positive for IGD. And again, patients with IGD had significantly higher total score on PHQA. I have summarized the findings in our study. The severity of internet addiction is correlated with the severity of depression. The severity of excessive gaming is correlated with the severity of depression. Adolescents with excessive gaming could have depressive symptoms. As conclusion, appropriate use of the internet and proper gaming behavior are important to prevent mental health problems among adolescents. Early preventive interventions are needed for this purpose. Thank you very much for your kind attention.